faculty colleagues, and my dear students. Indeed, it's a pleasure for me to be here. My first visit here, of course, and I was very excited when I was asked to kind of attend this session, because what is very close to me was said that research is something which we have been doing, and I probably have crossed the path which you are starting today. So I felt, and I have been always been trying to ignite young minds and probably make them aware of how they can really put an effort and contribute to the science and the society in whatever they're going to do in the future, right? So distinguished guests are here, and they're all experienced people, more than me, right? So probably today's address would be all for you, right? And I will try to take you on a journey which probably I have started in 2005 when I was sitting there. I mean, not here obviously, but when I was starting my PhD at IIT Kharagpur. And from then things have really unfolded, and I started to learn, and my understanding about research, my understanding about life, my understanding about myself started to change. And thanks to all influencers who have been contributing to this change in a positive way, and many of them where my duty today is to influence you. I have been attending many talks, and that probably shaped my journey in a more comfortable way. And to all the teachers who have kind of shaped me to whatever little I am contributing in the field today, right? So it's a giving back to the society, and it's giving back to dear students like you. So I would like to take you forward through the science that we do. I will not go into the complexities because I understand you're from diverse background. What I'm going to tell you is how you can think rationally, right, to whatever field you are in. Nothing is good, nothing is bad. It is what you put in, and how you put in, and how you start to think. That's what matters at the end of the day, right? So with permission from the members here, now here, whenever I was asked to choose a title, I was really thinking. I told her that give me a minute, because I'm over another meeting with the director, and I really need to find a title which probably is best fitting to today's the audience. Then I thought, you are here to do science. Now when I say science, it is not only medical science or engineering or something, it is about humanities as well. Science is something, is a thought process. It is about how you think, right? And the other thing here, in what I've tried to club in, is the society. Because what is very important in today's time, and probably is the science being existing, is because we have to contribute in some way to the society, right? That is what is our responsibility and role as researchers or educationists. That is what our primary goal here. So I thought, okay, fine. I mean, let me put you my story here, how we try to address this, and using the things that we are doing at IIT Guwahati. So primarily, I am, as was introduced, I am a faculty at Biosciences and Bioengineering, and I am also now associated with Center for Nanotechnology. We are coming out with a new school with entire funding from US, philanthropic funding, and the school is Health Sciences and Technology, and that is taking care of some of the aspects what I'm going to show it to you, right? So basically, as I said, though I am a biologist, I learned to understand life. Now, life means how we have grown, how we have born, how we have grown, and how we adapt to situations. I'm talking about healthcare scenarios. We all face situations where either we are in a disease state, we have burn, bruises, cuts, whatnot, right? And in unfortunate traumatized conditions, there are people who may lose certain parts of the body, and then that's where the life changes. Where? Because then suddenly there is a crisis, and the relatives and the closer people start to look for donation. Donation of what kind? It can be blood, it can be organs, right? So you all have heard that if somebody is losing the functional liver, right? So what is next? Though we need to have a donor who would give the donation and the person's lives can be saved. Though this is simple to assume that, I'm getting an organ or a part from somebody and the doctors would put it in my body and I will come to normal functionality, but in life, in reality, it doesn't work. Why? We humans are a well protected system. How will I put it? Whoever has made us, whatever we believe in, has made us very protected because we are surrounded by pathogens all around, meaning it may be bacteria, it can be fungus, it can be so many disease causing agents, right? Now our body is so made that we have to do our job, responsibility in terms of working and contributing, but we should not get infected by it, right? So what I mean to say, we have a protection layer in terms of the immune system, we call it, which are the guardians, which are the soldiers which protects us. It doesn't allow anything from outside to come within us. So it also doesn't allow the organs to be taken from anybody to be implanted in us. And that is a big problem now. Because it is for a good reason the doctors would want it, but the body doesn't allow because it is very neutral in not allowing anything which is outside. Now, and we also know that organ donation is something unfortunately not very, very popular. It is, we have our own limitations, either thought process or whatever you call it, where we are reluctant to donate, right? We feel maybe next life, if you believe in next life, maybe we'll have, some of the concepts people think weird, crazy things, that if I donate an eye, maybe next life I'll be blind, right? I mean, we don't know even next life, So we are reluctant. Sometimes, as I said, matching donors are not available. What is the goal? What is the way? The way is if you can create this in the laboratory, and that is what my laboratory here works on. Of course, there are number of researchers across the globe. It's a very popular field across in the European and American continent where it is called biomedical engineering, where they are trying to develop organs and tissues to be transplanted to human beings to save life. Now, the important thing here is to address a problem which is the need of the society, right? So for you all, irrespective of the field that you are in, it is very important. It can be in humanities, it can be in mathematics, it can be in computer science, it can be in biology, it can be in chemistry. You have ample of problems that needs to be addressed, right? So this is a chance for you to discuss with your mentors who will be your guidance. No, because why you need a guidance? Now, we are called a guide, Why? Because the expectations from us, being an experienced person, to a new student is to tell him or her what is the way out to solving a problem, right? It is not expected of me to do the thing myself and you can be an observer, right? That's why the term guide, why I am telling this is very important, because we have our expectations from the mentor that will be assigned to you when you all are PhD students, I'm told, right? So it is your PhD, it is your baby, I always call it. You have to nurture it. It is the role that we play is the role of a nanny who would guide, who will mentor, will tell you that there is a way out. This can be doable, this may not be doable, and this may be an alternative approach because of the experience that we in. But it is you who have to think over. Where from you start to think? It is the knowledge available in the literature domain. That's very important for us to go through. You can start thinking, I can start from anywhere. I can say, okay, I want to change the world, I want to make something, because it is coming to my mind. Am I the first one to do it? Probably not, or probably. If that can be only ascertained when you read literature. So it is very important for us to know what has happened and where from we start. We want to avoid reinventing the wheel, because we should not do something that has already been done with, because that is a wastage of energy and time, right? So all of you should do this exercise, and it is always said a good PhD or a good experience in research or whatever the field you are in can be achieved if you have done a good homework, and this is the homework is required for you to be done. Now in us, as I was saying, we have very much fan of Harry Potter, right? We have all seen movies and we have heard about How can the phoenix rise from the ashes? Right, the phoenix rising from the ashes, right? What does it mean? That even the smallest particle, the ash, which is a constituent of the phoenix, can create another phoenix. And it is true for us as well. If you look at the liver, right, we in our entire body, we have strong regenerative ability. Now you can think, if we have strong regenerative ability, why we need a donor? Why we can't regrow us what we have lost? This is available in lower group of organisms, annelids, planaria, lizards. I mean, we are all in childhood, we're running around lizards, touching the tail because we used to find it fun. If you touch it, what happened? The tail would lose out. And after a week or two, you'll see a small tail coming out and it is regrowing. Same thing for tadpoles. If you cut one of the legs or the hands, it is regrowing it back, right? Wish we had that, but there is a reason we don't have it, right? For a good only, we don't have it. Now, the question here was how we address that. And as I said, we are here targeting creating organs and tissues which are transplantable and acceptable to the body. It's a big challenge, right? Now, another thing what I want to advise you to is in terms of collaboration. Now, what is very important is we may think sometime that, okay, I have a very good understanding of something and I can do it alone. Maybe you can do it alone. But trust me, anything what needs to be translated is a teamwork. A teamwork is very important. So is in a PhD. What I'm not saying that your thesis would be entirely a teamwork, but what I'm trying to tell you is you have a goal to achieve. Now you have to identify what is the major chunk of the problem statement you are a master of, you want to be a master of. There will be certain peripheral things where you have to get help from. And that is what is very important because this is a training period. We always say it, in our institution, and I trust all of us have got the same advice, that PhD is a training period. It is not about making you a master in something immediately in 3, 4, 5, 6 years of time. It is about pushing you through this domain where you get trained to absorb things as you experience them. Because there is no better way than to experience certain things. Not the bad things, but the good things I'm talking about. It is always better to learn from mistakes of others rather than repeating it yourself. Because it can be really bad. Right? So that is what we expect. Now coming back to what we are doing, because there is a paucity of time, I'll quickly go through and I'll go through in a very laymanish kind of a way so as to better reach you. So this is a slide with the pictures of my students who are contributing to this. So when I say my students, it is you will be a student to somebody, right? We take pride as guides where we have a family, where the lab is our family and all members are our family members, right? So this is the feeling you should be developing in when you are working in a laboratory. It's very important. It is not that individually you would create a domain of yourself and not crosstalk with your colleagues who are in the laboratory. It's very important in either a laboratory, at home, wherever you look at an office. It is the bonding that you develop with the colleagues that takes you forward in a much better way, and you learn from each other. That's very important. Now in this one, we are a family, as I said, and these are the things we have done as of now. Now you see an entire list of probably a lot of organs, a lot of tissues what we are working on. Now, as I said, science and society. So the science that we are doing here, as I said, is about how to create these organs and tissues in an amenable way, affordable way, so that we can transplant them. What are the problem statement what we are addressing? So as I said, problem statement, identifying problem statement is very important. For example, the first one, we're talking about a liver. We all know about liver cirrhosis, we know about liver failure, and I told you that donors are very difficult to get. So can we create that in the laboratory, which would be similar in functionality, which can be transplanted, implanted by the surgeons to patients to save life? So that is what is one of the project we are working on. Vascular grafts, so blood vessels. We all know about bypass surgeries, right? So bypass surgery is nothing but when while lifestyle, because of our lifestyle and the conditions, the food habits, bad, not so good food habits we have, cholesterol deposition, the blood vessels get clogged, and there are ways of taking care of it, but when it is the far end, the doctors would say you have to go for a bypass, meaning there would be a shunt created in the heart and you need a tube, right? And that tube will be able to carry blood, right? Now you can create something like, some of you may be doing gardening, right? So you can think, okay, just a tube, I put it a tube and then it can do the job. People started with that process, but we realized that it is not the best of the things, right? It has to be more human-like. I'll talk about in some of the slides quickly, I'll go through, right? So what I mean to say is, it is not the external feature of any tissue or an organ, it is the internal build that is very important in terms of functionality, what we try to recreate. We are working on a very important aspect of in vitro models. Now, this is a very new concept where you all know that any pharmaceutical company which develops molecules in the industry, they needs to come to the humans, because the medicines we take, it is developed by a pharma company. And it is not that next day the pharma company can sell it and we can have it, because it has to go through a long phase of testing and validation, safety purposes. Now they are done in a different way. So they are done in the laboratory, then they are done in the animals, they are done in the humans, and then it comes to the market. As I said, animals, so a lot of animals are sacrificed, right? For example, if somebody is doing a molecule for curing heart ailment, so it has to be tested in animals. Now, because of government guidelines, now governments have stopped testing on the animals. For example, cosmetic products, the creams and other things which were earlier tested on animals, it cannot be tested on animals now. What is the way out? In vitro models or disease models are petri dish created in the laboratory, which are disease phenotypes. So it's a diseased heart, it's a diseased liver, it's a diseased skin or a normal skin, where the molecules can be tested. So it is equivalent to an animal substitute, but you are not killing an animal. It's a human way of creating these in thousands of numbers where molecules can be tested. So these are the in vitro models we are working on. Wound care, I mean, it's a very popular thing where, diabetic ulcers, where these are non-curable, and so many kinds of acute and chronic wound anomalies we have. We are creating technologies, and one product is already in the market and 3 we have licensed, where we are claiming to accelerate the wound healing here. Then we're talking about drug delivery. So we all know that the side effects of drugs are huge, right? Why? Because if we are treating a problem, say a tumor, in one of the site, we have to take the molecules, and the blood contains the entire blood contains that toxic molecules. It's a toxic molecule actually. But we are treating only a site which is maybe in some part of the body. So can we focus on that area and avoid many things like side effects, cost, and everything we can do. So that is about targeting, where it will only go and kill the cancer cells and it will not damage the other cells. That's to avoid the side effects and the other consequences. We're working on cardiac patches. Babies are born in in today's world where they have a hole in the heart, and because of which the auricular, ventricular, mixing oxygenated, deoxygenated blood mix, and this is a fatal disease. Then there is no scope for doctors to do surgery with the small babies. So what is the option? If you can create a band-aid, I'm putting it in a simple way, it is about a band-aid, but it is a beating band-aid. Like a heart tissue which beats, this band-aid beats in the same rate as the heart. We created this, and now plan is to implant it so that this problem can be addressed. So why I'm telling you, because see, everything what we are trying to address is about a societal problem, a medical problem which needs intervention, right? Now we are also working on bioengineered disc, spinal disc. We talk about slip disc problems, right? Where the disc gets herniated, damaged, and there is a lot of excruciating pain. What is the available solution? Nothing. Doctors just to scrape it, and the patient would be bedridden all life. So as engineers, as bioengineers, our contribution should be something which we can create in the laboratory, which can be transplanted to those patients. We're working on meniscus similarly for sports injury. There is a meniscus soft tissue between the long bones in the leg, and it can get damaged, and there is no solution for that, right? So for old aged patients, for people who are suffering from osteoarthritis, right, we're also working on some of the other concepts in terms of developing cosmeceutics and all. To give you a glimpse how it is done, so we take body cells. Body is the cells, the system that we have is the best system that we have. And the cells we often ignore. We are made of cells. If you look at any tissue, any organ in the body, they are made out of cells which do specific functions, right? So it's very important to take those cells, right, create them, make them in large number, and then put them on a scaffold and make these organs and then put them back. This is a very simplistic way of putting it. And what we also do is to understand them, right? So why I'm telling this is, in life science, we face a lot of challenge in terms of addressing the requirement of the cells. We always think, okay, how the system, our system runs. We eat food, the food gets metabolized, we assimilate the nutrition, and this nutrition goes into the blood. And from where it is circulated to all the organs and the tissues, right? And whatever that's why it's very important to have a balanced diet, because all this nutrition goes to different parts of the body and the cells take it and they keep on surviving and they do the physiological function they should be doing. And they being a living system, they know, they sense. You won't believe. The cells sense their presence, they sense where they are proximity to, and they move. They are mobile. They move around, right? So, why I'm telling you is we have to take care of our body. It's very important. Most times we feel it's a machine where we are born to do some activities and we should not be taking care of. It's very important that we do that. And also we do take care of the shear forces. You must be amazed to know that we individuals are so adaptive. For example, we go and hit the gym. If you want to make body, right, we have to go to the gym. So there is a very much science in that. You cannot go and do gym and don't take nutrition. You cannot build a body, right? So it's about building a body. It requires you break the muscles, you take nutrition, new muscles are formed, and that's how you build volume. Similarly, for bone growth, you need to have shear forces, and that is what we give to our organs and tissues to mature them. Now, coming back to the problem statements and how we should address. So here we realized that the world is trying to address these problems. We are not the first one, right? But there has been a lot of failures. So in your experiments, there would be a lot of failures. Trust me. If something succeeds in the first attempt, that may not be that exciting, right? Success and failure is our interpretation. What we consider as failure may be something which we don't understand, right? So if you want 1 plus 1 to become 2, it is okay, it is proven 1 plus 1 should be 2. But in science, if you are doing experiments, nothing is predictable, right? Because there may be various ways to interpret it. Because of a lack of knowledge, we may not interpret it in the right way. Why I am telling you this, it is very important for you to understand this part of the lacuna and see and observe, because most times the failure or the experiments that have failed has given you more exciting outcomes. In research, I think all of us who have done PhD would agree that it was full of ups and downs. And it is your enthusiasm in the downs that keeps you go up, right? And trust me, in my tenure, during my first 6 months, it was a hell of a problem, because I was trying to address something which was very new. And I was like, why in the world that problem was given to me, right? Why cannot have something which is solvable given to me, right? And it was so many failures, I had 2 CSIR nets. One I explored and joining my CSIR at IIT Kharagpur. Second, I reserved it. I was planning to run away in December and execute my second PhD somewhere else with a better topic, right? But one night changed everything, because I was trying to understand why it is not working. After that, I never had to look back. Why I am telling you this, I don't want this situation to come to you, but you never know. But this is something I think most of us have gone through difficulties, and it is something which we should use as to gain experience and learn from. Second thing, what I have experienced is, in terms of, I was telling about collaboration, right? So that helped me to gain new energy, new expertise, which allowed me to do new things. That is very important. And during my tenure, I was fortunate to go outside my university and explore and do experiments. And that came not freely to me. I fought for it. You should also find opportunities through fellowships, through collaborative opportunities which are plentifully available, right? Where, for example, your topic needs certain things to be done in collaboration with another university next door, or it can be in the next country, far off. But nothing should stop you, right? There are opportunities. You should discuss with your guide, chalk out a plan, and apply to those fellowships, right? And explore. In my laboratory, I take pride where all of my students not only are fellows and with their own fellowships, but they have got US Indo-US Fulbright fellowships. So though we are at IIT Guwahati, we always think location is very important. You may be thinking, okay, wish I was in Bombay, wish I was in Delhi, wish I was in there, London, US. Trust me, that is one state of mind. But if you are hardworking, if you are well planned, anywhere doesn't matter. I am at IIT Guwahati. I was still sharing my story some time back. I joined here in 2011, probably the same year this university was started, right? 11 years back. And a lot of advices came to me. Oh, why Guwahati? You are such a good biodata, and you can join any of the prime universities in IITs and all, and you should go there, live in a good city. Why I came here is because of this slide. This is nowhere available. Silk. I work on silk. Now you may be thinking this fellow is talking about creating organs and tissues. Now suddenly he is talking about using silk. Silk is very close to us, right? All of us. Right, we know it to be a material, golden material like Muga silk. We seen our moms and relatives wearing shirts and so many things we take pride of. Have you ever thought this material can be used to make organs which can save life? Why I am telling you this? Because this is what is called beyond the boundary applications of certain things which we have never thought of, right? And there was so much of resistance initially, ignorance, and so much of people saying no, this is not to be done, blah 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 blah. Now we have proven to the world, not to India, and to the world, that this is very much doable, and they have accepted this as one of the best materials for this kind of science. Right, it's one of the most sought after material for doing transplantation biology, and regenerative medicine using silk, your own silk. Could you have believed? Right, and because Assam and this area, Northeast is the hub of silk, I had nowhere to go than to come back to Assam, and that is where I came here. So my point here is, again, out of the box thinking. You may face a lot of problems. You may face a lot of criticism. Sometimes they may be correct. Sometimes they may be out of the world. You have to analyze. You have to, you cannot just listen to your friends. Friends sometimes only tell things which you want to listen to. Trust me, right? And I always tell to my students, right, you should have more critical, not enemies, critical friends who tells you what you are doing wrong, rather than always praising you. Oh wow, you are the best and you are the best, right? You may be best, that's absolutely okay, but you are not the only one doing that thing in the whole world, right? So why? Because in your formative year, right, you don't have much of ego, you are very amenable to learn. I don't know what will happen beyond a certain age, but I hope you remain the same, and I wish you remain the same. But you should take this opportunity to absorb criticism and give it a thought. What the somebody is saying, is it right or wrong, neutrally? That really helps us. We all have been absorbing criticism. Nobody put a red carpet to us, nowhere, not my funding agencies as well. Initially when I came here, I don't want to go into that details, but location disadvantage, funding disadvantage, instrumentation is not there, expertise is not there, my collaborator is in the US, Japan, where do I communicate? It was a crazy big time. you will face the same thing. Either reagents are coming after 6 months, something had to be done at some institution because the instrumentation is not here, but that is an opportunity for you to go and talk to people. That allows you to talk to people, and that is very important. We all did it, that's why we could solve the problem. Had we been in the comfort, we could have probably not. So this is my advice to you, to kind of take it positively. Second thing, when you do something, you should think about the society, right? In what way are you addressing a real life problem? That is very important. Whether that problem is already solved and you are trying to have a alternative of that. I can be very smart, thinking I am smart, but that is probably not the best way to think smart, right? Unless people believe I am smart, right? So what I mean to say is, I can be fooling myself by doing something which has already been done, and I'm just making delta change and saying, okay, I am a new thing with me. It can be in any of the fields. But what is very important, you contribute very small, but you contribute something which is new addition of knowledge. That is very important. Don't think how much you have published, how much you have reached, how popular you have become. That is not the success. The success is whether people refer your little contribution, people read it, and people say, oh, this fellow has done this, and this is is taking the field towards forward. That is very important, right? We may not think, I used to never think on that way. Now after so much of years of putting myself into this, I realized unless we have touched that basic points rightly, I would have not been able to do this. It is not about just flowery things and superficial things. It's very, very important for you. Another thing is about what you create to be able to be reaching everyone. That is very important. See, in our science also, you may think, of course it is, something which is very new, very interdisciplinary. I have in my team doctors, surgeons, the best of the surgeons, even the current Director General of ICMR in my team, veterinary doctors, who not, engineers, electronic guys, all of them, because it needs. So why I mean to tell you is, nothing can work in silo. Everything works in collaboration, right? It is very important to allow people to come in, discuss and talk and work towards something which would reach to the masses. And the reason for using silk is it is available in plenty. It is a very affordable material. The current material what people use, 10 grams of it cost 10,000 rupees. 10 gram of silk would cost you 10 rupees or 15 rupees or maybe 30 rupees. After processing, maybe 100 rupees. So what I am doing, I am using a material which is super affordable to create something which can reach to the masses, because the cost would be much lesser. Right? It's very important. Anyway, I'll skip most of the slides here because of the paucity of time, I think. But one technique I'm going to introduce you to is, why I'm introducing this? Because every day something new is coming in the field, in whatever field you are in. It is very important for you to read and be aware of. Because it gives you an opportunity to explore that and use that. I can be very proud of not reading something and thinking, okay, what I'm doing is the best I could do. Right? But probably that is not the best way forward. So in our field, we have 3D bioprinting. You must have heard of 3D printing, very popular. 3D printing, 3D printers, this, that. Now we have 3D bioprinters. So it's like making something in a machine would made. So the machine would be fed with the design. We have certain cocktail components fed to it and the cells. In half an hour, I get the organ and the tissue coming out. It's like pizza coming out of an oven, freshly baked. So have you ever thought, first point, thinking organ making, and that too of a machine in a highly automated way, and that too in down the time of 1 hour? Who would have thought, right? So these are the developments of the field, right, where you can replicate. I'll just quickly go through. I'll just not go into all these detailed scientific parts, sorry. I'll just go through one couple of slides at the end. This is all about what I said already, right? I know about the different problem statements, what we are addressing. Yeah, some of the, as I said, you want to be somebody who contributing, and it is always feels good when it is acknowledged by the society, right? So that gives you energy. I'm not saying about popularizing about what you do, but it is about feeling good, because you must have felt that if you feel positive about doing something and people coming and tapping you at the back, okay, saying, hey, you have done a good thing, you feel a lot of energy. Next day you go and try to do more out of you, right? And that is very, very, very important. So give comfort to your colleagues in the laboratory. Talk to your supervisor. Supervisor is not your enemy, trust me. When I was sitting, I'll just probably take 1 minute to explain to this. When I was doing my PhD, I had a very different version of thought process about a supervisor. We thought they are there to make me work for their own good. I'm making very flat state sentence here, right? And everything I am doing, but the other side is not giving me, right, much what I expect, what I deserve. When I become a professor, the same day when I sat on the chair, my thought process reversed, and I felt more thankful to my supervisor. Why? Because when you come to the other side, you realize what are the contributions that side is making for you. There's so many other things that needs to be put in, right? It is not only you that contribute and make something going. It is everybody. So we have to become neutral and acknowledge that part as well. And then only you become a close-knit family, what you do. Now, what very important is, I'm going to tell about to you, is whatever you do in any field, you should realize the value proposition of this. It's very important. I know after Shark Tank coming to India, we all have realized what technologies and what startups can do, right? I'm a big fan of Shark Tank Australia Global when it was launched 2-3 years back, right? Why? Because it tells you that something what you think is trivial can be a global problem-solving, problem-solving statement and a product which can bring revenue. You can put it in the trash, but what you're putting in the trash is something which you can contribute to your country in terms of generating revenue for. So whatever you do, you think from the perspective of creating and protecting IPR, intellectual property, which means you have created this, government would give you a patent for this, and it belongs to you and the university, and you can license it or transfer it to an industry where they will scale it up and make products out of that. It's very important for you to understand this part. This is a big parcel of the PhD that you are doing. In our process, whatever we do, we make sure to protect the IPR. Another component is you should start thinking at a little later stage along with your supervisor whether there is an industry which would like to take this. Right? And there are, if you are making something which is societal, which can be taken to the industry, there are industries, after looking at the value proposition and the market model, they would be very interested to invest in that and take it forward. Trust me, right? So this is what we are doing, the technologies. Who would have thought Kareena Kapoor would be our brand ambassador for one of the products? I never thought. And this, what work I'm talking about, which go into the market, we did in COVID time. When the university was locked down, it was closed. Me, my student, one student, and my wife, because we could, we are staying in the campus. Government came to us, there was a meeting with the minister, and they said, world is going through a tough time, and India should contribute in terms of protecting people. What was the problem statement? Corona is spreading like anything because of secondary infections. Can we contain it? What we came out with is a spray, nano formulation from the science that we know. When you apply it onto the surface, it makes a protective coating. When the virus comes on top of it, it gets destroyed. Not one time. So it's like not a sanitizer. Sanitizer only protects you one time, and you touch again, you are contaminated. You clean with this, your hands or the surface remains protected for 24 hours, even we have looked at 3-4 months. So that means secondary infection can be prevented. And it was such that 34 companies came to us to bid for it, right? And we turned from nowhere to somewhere in 6 months' time. With regulatory approvals, testing, everything, in 6 months' time, we reached to them with the highest bidder who paid the highest premium for this to the institute. And we failed 500 times in these 6 months, if not more. Right? So, conviction is very important, right? This is my team. I would like to thank, because whatever I am claiming to be mine is ours actually. and we are a very close-knit family, and it's very important for us to stay together. And I feel if my student rises up beyond me, then that is my contribution. Trust me, all your supervisors would be feeling the same, right? So they are not competitors to you. They are a channel to direct your energy in the right direction. So take it in that sense. It's very, very important, right? Rest would fall, everything in place. You have a guy to take care of, right? And Guwahati campus, we all take pride of. Your campus is very beautiful. I came here, I was really surprised that in 11 years with the A grade and so much of infrastructure, you are in the best of hands. Trust yourself and do your best. And thanks to all of you for your time. And I would be happy to take on questions. I'm sorry for spilling beyond my time a bit. Yeah.
Unfortunately, I'm from social science background. So I would like to ask you if you enlighten us something regarding that, social science background.
Right. So see, in IIT system, we have included HSS as one of the most important verticals, right? You may be thinking what IIT would do with HSS department there. Probably I'm answering your question, right? So when you are in HSS, right, you have science and society, you contribute from the society side. Right? The scientists need a lot of hand-holding in terms of understanding the perspective of life, perspective of society. I think that is where immensely HSS or humanities contribute. Right? Because when you are doing a thesis, it can be any of the topics. It can be on literature, it can be on certain person, it can be on certain thought process, it can be on certain religious or some specific community. You are bringing it to us. And that is what we use. So your contributions are immense. Trust me. How it can be possible that without humanity science can contribute? No.
Extending the same observation, I would inquire about. I'm also a social scientist, and I was wondering that how you probably would relate it with ethical issues as such. Human cloning. These issues are raised all over the world, Europe, North America, elsewhere. And I was wondering that in your specific case, did you encounter any issues which are basically revolving around social sciences and philosophy?
Thank you, sir. So, sir just answered, helped me to answer you. So, he said about ethics. Where from the ethics concept came? It cannot be a contribution from science, right? So it is from the society through the humanities vertical it has come that what you are doing is good. We appreciate it. But in the process, are you taking care of the nature? Right? Are you hurting somebody knowingly and unknowingly? And how would you make sure that what you do is in the benefit of everyone? That is what is ethics guides us to. As I said, it is heavily dependent on experiments. It is heavily dependent on something which we have to rely on living systems. The animal trials, we have all seen vaccines. It was one of the fastest thing that has come up to the humanity, right? But it has gone through all the phases in a very fast manner. Now, what's answering Sir's question, whether we encounter or not, yes, we do. And we are very sensitive to that. That's why I said in vitro models when I talked about, it is an outcome of researchers thinking and wishing to contribute that how we can eliminate or at least reduce sacrificing animals. One thing is very evident that if you have to pass the boundary of safety, it has to be testing. It cannot overlook that, right? I cannot bring something to the market without testing. But in the process, if I am able to lower down harming animals or intermediaries who are part of this, that is the contribution. So in vitro models are a great contribution of science where they are trying to remove the entire animal testing portfolio and so that lives can be saved of the animals. Another thing is about ethics in human cloning, iPSCs, so it's about creating another version of you. It may sound very interesting, but the question is it needed? Or can we have designer babies? This is something which is, very, very, was a bookish concept. It has become reality now. People are thinking, oh wow, I mean, we have the cancer genes already. It is in a suppressed manner. And this gets expressed because of some of the triggers, environmental triggers we get, right? Leading to some sort of cancer. Can we eliminate it? The first question is why it is there in the body. Second question is removing them, are we doing a good for us, or no, this is something which is accessory, right? Also about using cells from embryonic stem cells. There was a huge uproar because we do use not embryonic stem cells, we use induced pluripotent stem cells. Yamanaka got a Nobel Prize some 5 years back, Japanese scientist. So earlier, embryo cells were taken and they were used to create organs and tissues. Why? Because they are progenitor cells. They can make any kind of cells. That was the blessings they had. But in the process, you are destroying embryos. It's life. It was a life and it would grow into a new life. Was it ethical? It was not. So researchers came out with an alternative. I can take cells from the skin, put some genetic manipulation and make it like embryonic stem cells. These are known as induced pluripotent stem cells. Just because students like them, people like you who are from the vertical of humanities, sensitized us, the community researchers, we start to think from the other direction. And that led to contributing something. So this is the contribution you can have. Anyone daring to ask a question? Madam.
I am from arts stream.
Madam.
My subject is education. Psychology is my favorite subject. I want to ask you that what is the psychological attitude to the research work? I need the experience, and so I request you to tell me about the psychological attitude of the research work. Thank you.
Very important question. It is the attitude that determines who will be where you will be after a certain number of years. It is not the infrastructure that you are put in. It is not the location you are in. It is the state of mind. And what guides the state of mind? Probably all these external factors. These are all correlated. My state of mind can be positive only when I see things at par my wish around me. Right? But there can be other way also. You have to realize what you really want and what is external and additional to you.